Meet Jim Alexander, a successful 55-year-old overweight stockbroker. Jim is one of the 13.5 million Americans who suffer from coronary artery disease, and one of the 1.5 million who experience a heart attack each year. 10 days ago, Jim had come home from work after a particularly stressful day. After dinner, he began to have symptoms of heartburn, which didn't go away after taking an antacid. In fact, the discomfort actually became worse. After 20 minutes of pain, he became weak, pale, sweaty, and nauseated. He agreed to be taken to the local hospital in an ambulance. After evaluation in the emergency room, Jim was diagnosed with a probable myocardial infarction, more commonly known as a heart attack. He was admitted to the intensive care unit. To make the diagnosis of myocardial infarction, several tests are usually performed. These include blood work and an EKG. Abnormalities in these may indicate that a heart attack has occurred or is occurring. What happens to the heart during a heart attack? During a heart attack, there is damage to some portion of the heart muscle due to a lack of blood supply. When working normally, the heart is like a pump that is responsible for supplying blood to all organs of the body, including the heart itself. The blood is supplied to the body through arteries that branch off of the aorta, and to the heart muscle itself through the coronary arteries, which also branch off the aorta. When the blood supply to the heart muscle is interrupted, damage to the heart muscle may result. This is a heart attack. Damage may result in a weakening of the heart muscle, which affects its ability to contract forcefully. Here, the damaged heart is not strong enough to maintain an adequate blood supply to meet the body's needs. A heart attack could result in damage to the special nerve conduction system of the heart, which affects its ability to contract in a regular rhythm and rate. Irregularity in the rhythm of the heart is called an arrhythmia. The interruption in blood flow to the heart is frequently the result of atherosclerosis. Atherosclerosis is a progressive narrowing of an artery. Fatty deposits called plaque build up on the inner lining of an artery, causing the artery to become narrow. As the atherosclerosis progresses, there may be periodic episodes of inadequate blood flow. This could cause chest pain, known as angina. Angina is a symptom commonly associated with a heart attack. Often, there is a precipitating factor to an angina or the related heart attack. These factors include stress, exercise, eating a large meal, or any combination of these. The feeling of helplessness one faces during a heart attack is paralyzing. However, more people are living through these events due to better initial treatment procedures and education after the heart attack. What happens after the initial heart attack? During his stay in the emergency room and the several days in the intensive care unit, Jim was treated with pain medication, anticoagulants to decrease the formation of clots, vasodilators to dilate the coronary arteries, and antiarrhythmic medications to keep his heart in a regular rhythm. These are all common medications given to heart attack victims. During this time, Jim was anxious, fearful, and concerned primarily about surviving. Would he die? Would he live to see his first grandchild, or long enough to see his youngest son graduate from high school? Who would provide for his wife and children? Jim thought, I'm too young to die. When his cardiac enzymes returned to normal values, his physician began to develop a long-term plan of care and rehabilitation. Among tests performed during this time was a thallium stress test. This is a common test given to cardiac patients after they have been stabilized. It helps the physician evaluate the cardiac status of a patient. After his stress test, Jim was transferred to the step-down unit. He kept the door to his room closed and did not want visitors. He wouldn't talk with his family. He was convinced he would not be able to lead a normal life. Depression following a heart attack is not unusual. It is associated with feelings of being damaged, inadequate, being fragile, or impotent. Learning to live with heart disease can be accomplished best when an individual participates in a cardiac rehabilitation program. Cardiac rehabilitation helps individuals with heart attacks as well as other heart problems recover faster and return to full and productive lives. Effective cardiac rehab involves education, exercise, counseling, and learning how to develop a healthier lifestyle. Cardiovascular rehabilitation programs generally are divided into 4 phases. Phase 1, early rehabilitation, occurs during hospitalization. The goals of this phase include prevention of physical deconditioning, patient education regarding risk factors, and interventions aimed at preventing psychological disability. Phase 2 begins at discharge and continues for 3 to 6 weeks. Often this phase is coordinated with a home health agency with home physical therapy visits. The goal of Phase 2 is to return the patient to the level of physical conditioning that existed before the cardiac event. Education of the patient and family about risk factors is important in this phase and continues into the next phase. Phase 3, the late recovery and physical training phase, is designed to increase the patient's level of physical conditioning. Research has shown that the most consistent benefit occurs with aerobic exercise training at least 3 times a week for 12 or more weeks in sessions lasting from 20 to 40 minutes. Strength training can benefit patients' performance of activities of daily living. Research has shown that exercise rehabilitation decreases angina in patients with coronary artery disease and decreases symptoms of heart failure in patients with heart failure. Cardiac rehabilitation exercises are safe. Because a thorough assessment of cardiac function is done before placing someone in a cardiac rehabilitation program, there is an extremely low incidence of having a heart attack while exercising. Phase 4, the maintenance or follow-up phase, completes the cardiac rehab cycle. The goal is to encourage lifelong adherence to the health habits established in Phase 3. Follow-up visits with your physician should occur at